It is not a strange phenomenon that some people who were born male feel like they should be female while the others who were born female feel like they were meant to be males. This has brought about substantial debate on how to handle this class of people with regard to gender. With their ever-growing numbers, the society is compelled to accommodate them and provide to them the essential services too. This has even necessitated for the provision of transgender health services. Here are some therapeutic measures employed to attain the desired body for a male transforming to. Males are different from females physiologically, psychologically and emotionally because they were created to perform different roles. A man seeking to transform into a woman, therefore has to undergo hormonal replacements. An expert should handle this exercise failure, to which will lead to adverse effects on the patient body. The purpose for replacing these hormones is to change the secondary sexual characteristics of an individual. Testosterone and estrogen are hormones present in the body in different quantities. Men always have an increased level of testosterone as compared to women, while women have a raised level of estrogen compared to their male counterparts. Testosterone is the hormone responsible for the masculinity of a man's body. The objective of this procedure, therefore, is to raise the levels of estrogen in trans women to reach the levels present in the female. This is an important substance, since it controls the menstrual cycle, moods and even libido. Progesterone is another important hormone. This is an important substance in a woman responsible for the skin texture and also affects the urge of sex. This should be given to trans women to enable them develop breasts. Such development will take care of the mammary glands and the alveoli, just to name a few. Other than the surgical procedures, this method has proved an effective option. The first step in this program involves introduction of anti-androgens to help deal with testosterone. This helps to suppress this hormone prior to surgery. This does not spot testicles produce this hormone, as it is not needed at this time, but anti-androgens render it weak, so as to allow the estrogen bind with the androgen receptors in its place. It is good to know that hormone replacement therapy cannot reverse the changes experienced by an individual during puberty. For instance, the location of body hair will require another procedure to deal with. This will diminish slowly over time with the falling levels of testosterone in the body. There are many other changes, like the bone size and length, which reaches the DNA predestined size at puberty. Many people are usually taken through this therapy. However, to completely alter the sexual orientation, a surgical process is mandatory. This is usually done to replace the sexual organ with that of the desired gender. The sensitivity of the procedure calls for experience of the medical practitioner to ensure the functioning of the organs. In conclusion, you will agree that this is a change one has to face, whether it is a family member or not. Good transgender health services are needed. Failure to that would lead them into seeking health care support from non-qualified people who might end up ruining their lives. Good news is that there are also herbal remedies for such purposes.